All right, in today's lesson, we're going to focus on something called the health promotion model. So what exactly is health promotion? Well, health promotion focuses on wellness. Some goals of health promotion are things like preventing disease. You want to promote overall wellness. You want to reduce the likelihood or occurrence of illness, the likelihood of getting sick. There are several different models out there that are called health promotion models, but the gold standard is one by Dr. Nola Pender. She was one of the pioneers in health promotion models. And she organized this by focusing on these 5 key principles. And they are person, environment, health, illness, and nursing. So when we say person, what do we mean? Well, the health promotion model is first about the person or the patient. As a nurse, you need to look at your patient and you want to identify some key factors. These are things like their eagerness to learn. Are they willing to change? Do they understand the severity of an illness or disease? For example, let's say you have a patient with COPD, which is chronic obstructive pulmonary disease, and they smoke. And they're eager to learn, but they are absolutely unwilling to drop the habit of smoking. Then you have a barrier that you have to overcome. Patients have to understand how sick they could actually get. That's where you come in as the nurse. You come in to educate, and you have the ability to educate the patient on how this could affect them in the long term. When we look at environment, we want to look at things that are called extrinsic factors. So these are things outside of the patient's own life or control. These are things like family, work, socioeconomics, et cetera, et cetera. When you have a patient who is willing to learn and they're eager to learn and they want to improve their life, but let's say they don't have any money to get insurance, that's a barrier. And so when you're talking to your patient, talk to them about their family, their work, their insurance, what kind of insurance they have, their home life. If you can help them identify barriers that they may not see, you actually serve to help them there. And then you can give them resources if they need it. So when we talk about health, we want to be talking about promoting health. And when you promote health for your patient, you need to think about their current health status. How healthy are they, right? Do they have diabetes, or do they have high blood pressure? This stands for hypertension. Are they at risk for disease? You also want to look at what their goals are for health. So do they want to run a marathon, or do they want to be active in some local sport event? The goal here is also to always aim for self-improvement. So you want to make sure that they're doing this at all levels, all the time, regardless of how healthy they may be. Let's take a look at illness. So in the last slide, we talked about diabetes, and we also talked about high blood pressure or hypertension. When you look at the illness aspect of health promotion, we want to look at how illness affects your patient. Is the illness chronic or acute? So here's an example going back to these. If your patient has hypertension and what you need to do in order to promote wellness is you want to promote something like cardio exercise, maybe on a treadmill, right? But what if they can't handle the treadmill? That basically means that their illness is impacting their health. So we have to gauge at what they need or what they can handle, especially in terms of like a cardiovascular illness. You can't just tell your patient to go get on the treadmill and you're going to shoot for a 7-minute mile. They just may not be able to handle it. And that's why you have to look at their illness in addition to their overall health. One other point that I want to talk about is their acuity level. So do we expect this to be like treatment or management? So like a cold or some flu virus, you're going to be looking at treatment. Whereas something like this, we're talking about management. So if you have a patient that has a cold, we can expect something like this to be short-lived. So rest, fluids, proper nutrition, that helps them recover, and then they'll be able to exercise. The other thing you want to look at too is what is risk for disease when we're talking about illness. So family history of maybe a heart attack or a stroke in a patient who has minimal control of their blood pressure means that they just have a higher risk. So in this area, definitely focus on how illness or disease affects the patient. Lastly, let's take a look at how nursing affects health promotion. This guy right here. Think of it this way. So you are the infantry. You guys are the front lines. You're the protector of your patient, and your patient relies on you to help guide them and educate them. So you want to focus on your patient holistically. And you want to focus on them holistically, especially when it comes to health promotion. You want to learn to recognize barriers that they may not be able to see. It helps that we, as nurses, can be unbiased sometimes. The other thing you want to do is understand your patient's illness or risk. So that comes back to knowing them holistically. Also, know your resources, know your local resources and national resources for your patient. You can give them a pamphlet or a website. Those can be extremely helpful, and directing them to those organizations can help also to promote their wellness. Hitting some quick nursing concepts here. Health promotion is exactly as it says. Let's promote health, not only health, but wellness. Patients need us to educate them. And that also goes hand in hand with health policy. There are lots of initiatives for health nationally and locally. So make sure you familiarize yourself with those. Now let's recap. When we promote health, we want to look at our patient first, and we want to make sure they're ready to learn, they're eager to learn, they're willing to learn. Those things help promote wellness. We also want to look at their environment. We want to identify any of those extrinsic barriers so that they can, so that we can overcome those. Also identify strengths within their environment so you can advocate for those as well. Health is about how healthy the individual is. And you always want to promote those constant wellness goals. Whatever illness or diseases they have, take those into account when you're looking at their overall wellness. Also, can we implement the right health focused goals when they're sick? So just something to consider. Lastly, and as their nurse, you want to be the front lines, be the patient's infantry, give them the positive resources, give them the right information and education. You're basically the ribbon on the outside of this big present that you're giving them in terms of health promotion, and you keep it all together. That's it for the health promotion model. Make sure that you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.